Member for Lyme.
Thank you, Mr Deputy Speaker. Hypocrisy and hype. How often do we see this in this House? Hype and scaremongering. Who was it that actually expanded the chronic, or delivered the chronic disease dental scheme? It was the Coalition. It was the first vehicle for providing widespread dental care to 1 million people. Who got rid of it? The ALP. Who tried to make Medicare more sustainable by encouraging private insurance? The Coalition did. Who attacked it? Labor. All this hypocrisy is too much to bear. Who introduced the co-payment for the pharmaceutical benefit scheme? It was Labor. Yet when we try to make something sustainable and make it something that's going to last for decades to come, they criticise it.
Yeah.
You know, they have no credibility at all. Just look at the money they wasted on super clinics, trophy buildings that pinch doctors from other medical centres. They haven't really delivered much at all when you analyse what they're criticising. As that famous woman who ran Britain for more than a decade, pennies don't fall from heaven, they have to be earned here on earth. The same applies to the health budget. Governments don't create money. They're given it by taxpayers, and we're holding it in trust to be used wisely and efficiently. Taxpayers, that's primary industries, secondary industries, service industries, people that create wealth, who then pay a portion of it to the government, create wealth. But we have this school of magic pudding economics where the government pays for everything that just rears its ugly pudding head again and again and again. They have a PhD in economics in the member for Fraser, a doctor, and I think he needs to tend to the sick health economics being applied. It's in terminal decline, and maybe not even the good doctor could cure their health economic ills. The opposition doesn't seem to realise that it's not the universality that's being threatened, it's its long-term sustainability. Bulk billing has occurred on 237 million times last year. 4 out of 5 episodes to the GP were bulk billed. That's $12.8 billion. That is a huge increase. 45% increase in 5 years, or 122% in 10 years. Do they really think that that is a sustainable course? You know, simple home economics, people who've had to make their way in life and do their own books realise that that sort of increase is not sustainable. For those that do have a healthcare card, or for children, the co-payment occurs only 10 times, or $70. Do we really think 4 out of 5 people in Australia are all in that case where they can't afford $70? My electorate has more pensioners than any other electorate except for Hinkler. So the reality is that most people are able to afford $7, and after 10 visits or $70, it reverts back to bulk billing. Now, the other mistruth that gets peddled around here is that we've already paid for our Medicare services. The Medicare payment only covers half, let alone accounting for the increase. The Medicare levy, is the opposition going to propose putting up the Medicare levy by 122%? Or are they going to put up general taxation revenue by 122% to make it pay? No, they're not. They're just going to revert to the magic pudding and borrow more money and take it away from general revenue, which means there's no money for schools or for bridges or for roads. You know, they want to have it all, but they don't want to pay for it. And we just need a giant reality check by the opposition to make them realise that what we are doing is what a sensible economic manager would do, is to do what they did with the pharmaceutical benefit scheme, introduce a co-pay. It sends a message to both the orderers of the tests as well as the consumers. So it's not just for patients. There's a whole cohort of my colleagues that haven't had to be responsible for the costs they
The
incur for their
time
patients.
has expired and the discussion